Hello everyone. Today we are going to demonstrate about deep tendon reflexes.
Coming to deep tendon reflex, from head to toe, first is jaw reflex. Then in upper limb, biceps reflex, supinator reflex, triceps reflex. In lower limb, V jerk and ankle jerk. Coming to biceps, position during this reflex, flexion at the elbow joint and semi-pronated.
As he explained, first we should expose the complete muscle to be examined. Then, as he told about the position, elbow should be flexed and forearm should be semi-pronated. And feel for the biceps tendon. And we have to give a sharp jerk. So along with contraction of the muscle, there might be flexion at elbow. What is the root value for this reflex?
Sir, C5, C6.
Okay, very good. And now we are going to see supinator jerk. So for supinator jerk, elbow should be slightly flexed and forearm again semi-pronated, and we should support at the wrist and give a jerk over the styloid process where brachioradialis tendon lies. We can clearly see the contraction of brachioradialis. So the normal response will be flexion of the elbow and slight supination. And in some individuals, there will be minimal flexion of fingers also. For supinator jerk will be
C5 and C6.
Okay. Now we will see triceps jerk. So in triceps reflex, mainly the position should be elbow should be flexed at 90 degree, and we can ask the individual to rest the forearm or abdomen, or we can even support at the wrist and expose the triceps muscle completely. And we have to give the jerk over olecranon process where triceps tendon lies. So we can clearly see the contraction of triceps muscle. Along with that, we can see the movement, that is extension of elbow. So we can repeat the same reflex on the other side. This is about triceps reflex. What is the root value for this reflex?
Sir, C7 and C8.
Very good. Now we will see about reflexes in lower limb. First, knee jerk. For knee jerk, patient should be in supine position. Legs should be relaxing normally and extended, and we have to ideally expose the complete muscle, that is quadriceps muscle. And position is like this. We should ask the individual to flex the knee, and we should support knee with our forearm and feel for the quadriceps tendon where we will give the jerk. So we can clearly see the contraction of quadriceps as well as there will be extension of the knee. We can repeat the reflex on other leg. So we will give jerk over the quadriceps tendon, and we will look for the contraction of quadriceps muscle as well as extension of the knee. This was knee reflex. What is the root value?
L2, L3 and L4.
Okay. Now we will see about ankle jerk. Flexed and we should stretch the ankle. So with this position, give jerk over the Achilles tendon. We can see contraction of calf muscles as well as there will be flexion of the ankle. This is the normal ankle jerk. What is the root value for this reflex?
Sir, S1 and S2.
Okay, S1, S2. We have demonstrated biceps jerk, triceps jerk, supinator reflex, knee jerk, ankle jerk. Along with this, as he mentioned in the beginning, there will be jaw jerk, which is also considered as deep tendon reflex. In that, mainly, patient should keep mouth slightly open. We should give downward jerk over the chin. In that, we can see there will be closure of mouth as a reflex response. So that is jaw jerk. Mainly, fifth nerve is involved as afferent as well as efferent, and the center for this reflex will be at the pons. So these are deep tendon reflex elicitation, and whenever we see these reflexes, we should grade them. When we are grading deep tendon reflexes, we have to keep some points in mind. That is, when we are eliciting the response and we don't get the response, we should not comment it as absent reflex. First, we have to consider reinforcement methods, that is Zendersky maneuvers. With that, also if the response is not elicited, then we will mention absent reflex. But if the reflex is not elicitable normally, with reinforcement it is elicitable. In such cases, we can consider it as grade 1. Then for normal response, we will mention it as grade 2. And in exaggerated reflexes, there are two things. One is exaggeration, one more is brisk reflex. We call exaggeration when the range of movement is too much than the normal expected one. That is exaggerated response, commonly seen in anxiety and thyrotoxicosis conditions. And we call the reflex as brisk whenever we get the response immediately. Is the fastness in the response is considered as brisk, commonly seen in UMN lesions. And whenever we see these exaggerated and brisk reflex responses, we should always check for clonus. Clonus is repetitive rhythmic contraction of the muscle when we give some passive stretch. Mainly we look for ankle and patellar clonus. So this is all about deep tendon reflexes in neurological examination. Thank you.